Heat linked to higher added sugar intake. As temperatures rise, added sugar intake increases, driven mostly by sugar-sweetened beverages, with outsized impacts on lower income and lower education households. A peer-reviewed analysis of 6.9 million household months, 2004 to 2019, finds the strongest response between 12 to 30 degrees Celsius, 54 to 86 degrees Fahrenheit, at 0.7 gram more added sugar per 1 degree Celsius, with effects flattening above 30 degrees Celsius. Under a high-emissions scenario, SSP 5's 8.5, the authors project an average increase of 3.0 grams per day per person by 2095. In our results, the critical need is to mitigate health risks from the overintake of added sugar and to explore dietary adaptation to climate change, wrote Pan He and colleagues in Nature Climate Change. Why this matters for employers and investors. Excess added sugar elevates risks for obesity, type 2 diabetes, and cardiovascular disease, conditions that already drive the bulk of U.S. medical spend. The CDC estimates 90% of the nation's $4.9 trillion annual healthcare expenditures go to people with chronic and mental health conditions. The American Heart Association recommends 25 grams per day of added sugar for most women and 36 grams per day for most men. Many Americans exceed these limits. For businesses with outdoor or frontline workforces, construction, utilities, logistics, manufacturing, the paper flags a climate-sensitive consumption shift toward ready-to-drink sweetened beverages, the dominant driver of heat-linked sugar increases. Frozen desserts contribute modestly. Employers already planning for heat stress and hydration should recognize that product mix and access during hot periods can nudge consumption patterns in the wrong direction. Equity, who is most affected and why that's material. The temperature-sugar link is stronger among lower income and lower education households, with responsiveness tapering off at higher socioeconomic status, likely due to more stable microenvironments, air-conditioned workplaces, and healthier defaults. That makes this not only a public health issue, but a workforce equity and benefits cost issue for employers with large hourly workforces or outdoor operations. Geographically, the largest projected increases by century's end occur in northern U.S. counties, where warming shifts baseline temperatures into the 12 to 30 degrees Celsius band, where the sugar response is steepest. Seasonal spikes are most pronounced in summer and autumn. What companies can do now: build heat season nutrition into climate resilience plans, provide abundant chilled, no-added sugar options, water unsweetened beverages in canteens, vending, and mobile coolers at outdoor sites. Align wellness incentives and on-site defaults with AHA limits during heat waves and hotter months. Calibrate procurement and pricing. The study controlled for food prices and still found stable temperature effects, indicating physiological behavioral drivers more than price swings. But hot day promotions can amplify purchases of sugary items. Audit vendor contracts and seasonal promotions accordingly. Target equity hotspots. If your workforce skews lower income or includes many outdoor roles, pilot hydration-first stations, cool-down breaks, and placement of unsweetened options at eye level. Track heat season purchasing in on-site venues to detect problematic spikes. Product strategy for beverage/CPG brands. Expand low, no-sugar SKUs and reformulate ahead of peak heat months in value channels serving price-sensitive consumers. The paper finds beverages are the main channel through which heat raises added sugar. Policy and market signals. Executives should watch. Evaluations across U.S. cities show SSB taxes drive consistent drops in purchases, with 92% price pass-through to consumers and meaningful volume declines, evidence that fiscal levers can curb heat-amplified sugar intake. The WHO's 2023 Global Report documents accelerating adoption and provides design guidance that could spread to additional jurisdictions, affecting pricing, mix, and marketing. From a risk lens, consider the growing literature linking SSBs to global cardiometabolic burdens. A 2025 Nature Medicine analysis quantified country-level burdens across 184 nations, reinforcing why climate-amplified sugar intake matters for employers, payers, and brands. Methods and what's truly new here. Unlike prior supply-side climate nutrition work, this paper quantifies demand-side shifts in the U.S. using longitudinal retail scanner data, Nielsen HomeScan, maps the nonlinear temperature response, steepest between 12 to 30 degrees Celsius, 0.70 grams breeze, and isolates beverages as the primary driver. then projects century-end impacts under CMIP 6 scenarios. You've been listening to Sustainability Soundbites presented by E plus E Leader. For partnership opportunities, reach out to a member of our team.